Hello, my name is Elizabeth Chow, and this is my presentation on multi-state outbreak of Fusarium keratitis linked to contact lens solution. Step 1. Background. Fusarium keratitis is a type of fungal keratitis. It is a corneal infection with symptoms that can include redness of the eye pain, and excessive tearing. It can also lead to vision loss and blindness. This infection is usually associated with tropic and subtropical regions, persons who have experienced recent eye trauma or are immunocompromised, and it is also associated with people who use contact lenses. Fusarium keratitis didn't used to be associated with contact lenses until the 2006 outbreak. In March of 2006, 3 contact lens-associated cases of Fusarium keratitis were reported to the CDC from New Jersey. In May 2006, there were 130 confirmed cases of Fusarium keratitis from 26 different states and Puerto Rico, with ages ranging from 23 to 83 years old. Of the 130 confirmed cases, 125 of them were from contact lens users, 118 of whom reported using Bausch & Lomb's Renew Moisture Lock contact lens solution. Step 2. Current situation. In response to the outbreak, the CDC worked with the FDA to investigate the Bausch & Lomb's manufacturing facility in Greensville, South Carolina, and promptly issued public health alerts to inform the public about the situation. The investigation prompted Bausch & Lomb to recall the product, thus ending the outbreak. The strengths of the CDC's response to the outbreak included their ability to work well with federal, state, and local public health departments. While they worked well with domestic public health departments, one of their weaknesses is that they did not work with public health agencies of other countries. And building off that weakness, a potential opportunity for the CDC to take advantage of is to improve relations with international public health agencies. A possible threat still present is even though the Bausch & Lomb contact solution is no longer available on the market, contact lens users may not know how to or understand the importance of taking proper care of their contact lenses. The CDC's mission is to control infectious diseases and pandemic outbreaks, as well as to address public health concerns that occur from manufactured products. Ultimately, their mission is to combat disease and protect the health of the U.S. Step 3. Prioritize core issues. While fungal keratitis is usually associated with underlying eye disease, immunodeficiencies, or trauma to the eye, since most of the cases being reported were associated with contact lens users, the CDC investigated contact lens solutions as a possible cause of the outbreak. To determine the risk factors for the infection, the CDC performed a case control study that indicated an increased risk for Fusarium keratitis in contact lens users who use Bausch & Lomb's Renew Moisture Lock. In addition, the FDA ordered an inspection of the Bausch & Lomb's manufacturing facility and found that the facility had not maintained proper temperatures during the storage and transportation of their product, which was presumed to be a factor in the increased number of Fusarium keratitis cases. Taking this knowledge and moving forward, I think something to prioritize would be to implement regular factory checks. Had the factory in question been properly inspected prior to the faulty manufacturing, the Fusarium keratitis outbreak might not have occurred. Step 4. Analyze alternatives. Using the social ecological model of health behavior to analyze this case, we can see how each level of the model can play a role in the solution. On the individual level, people can learn proper eye care and learn how to maintain lenses safely and hygienically. On the interpersonal level, visits to eye care providers can help people learn how to care for their lenses in addition to getting routine eye checkups. On the organizational level, a system could be used to help notify eye care providers of a condition to check it out before it becomes a problem. On the community level, the media can be incredibly influential in helping to raise awareness of conditions. And finally, on the policy level, the CDC can support policies that promote healthy eye care. Step 5. Recommendations. The CDC recommended that contact lens users immediately stop using Bausch & Lomb's Renew with Moisture Lock and consult an eye care specialist on choosing a better contact lens solution. As for personal recommendations, my first recommendation would be for the FDA to implement stricter guidelines and regulations to hopefully prevent potentially dangerous contact lens solutions or any potentially dangerous product from being sold on the market. My second recommendation would be to implement a system for more healthcare insurances to cover routine eye checkups to promote healthy eye care. Step 6. Action Plan. While the 2006 Fusarium keratitis outbreak is now over, the CDC and FDA need to continue to be involved in raising awareness and promoting healthy eye care. By the year 2030, healthcare insurers should have routine eye checks included into all of their insurance plans, covering biannual optometrist visits. Also by 2030, the FDA should have tighter regulations on contact lens prescriptions and require contact lens solutions to be sold on a prescription basis. Finally, on top of tighter regulations, by 2035, the FDA should also have regular safety inspections set in place to ensure proper facility management and proper transportation for any health-related products set to market. Step 7. Opinion. I personally don't wear contacts or glasses, but relating eye care to dental care, I always seem to practice better oral hygiene after visits to the dentist. Extrapolating this reasoning to eye care, I believe that people would be more likely to take better care of their eyes and contact lenses after visits to the optometrist. As such, I believe that full coverage of eye checkups by health insurance companies would be in the best interest of the population's health and would help prevent future outbreaks. I also think that it would be greatly beneficial to the population if the FDA and CDC had closer communications with international public health agencies. If there were a more established communication system between public health agencies around the world, I believe more outbreaks could be prevented instead of having history repeat itself, as was the case with the Fusarium keratitis outbreak, where it happened in Hong Kong and Singapore, then in the US. And here are my references with the scholarly articles labeled in bold. Thank you for watching my presentation.